Hi, I'm Jerry Searle, and I would like to welcome you all to the new Fit for Life Fitness and Health program. Today's show is on preconception, and if you're about to start trying for a baby, we have the right advice for you. From knowing your most fertile time of the month to what foods and positions will maximize the chances of having a boy or a girl. We give you tips on how to prepare your body for pregnancy with exercise, and we have a delicious recipe to boost your fertility. Let's get started with the ovulation guide. Knowing your most fertile time of the month is key to knowing when you're most likely to become pregnant. So let me show you how to create your own customized ovulation calendar in order to determine this important occasion. There are many good ovulation kits on the market today, but they can be expensive. So if you want to chart your own cycle, this is the way it's done. Okay, first you need the date of your last period, and then you count the days till you start your next period. This is called your cycle length and is normally around 28 days. If you have an irregular cycle, when your periods start at different times of the month, it can make your chances of conceiving difficult and may be indicative of a hormonal imbalance. There are lots of products on the market, but a natural product containing the Agnus castus plant is very effective in treating this. Second, you need to know your luteal phase. Okay, this means the last phase of your cycle after ovulation. This phase usually lasts between 10 to 16 days and is consistent for every cycle. If you have a short luteal phase, less than 10 days, it means that your progesterone levels are low, and this tends to lead to early miscarriage. So if this is your case, increasing your progesterone levels will be beneficial for you. In summary, when calculating when you are most fertile, you must know how long your cycle is, say 28 days, then subtract your luteal phase, which is on average 10 to 16 days. We're going to say 16 days for today, and that will leave us with day 12. So day 12 will be your most fertile day to conceive. It's an inexpensive and easy method to use, but please ladies, don't use this in reverse as a reliable means of contraception, as nothing is 100% foolproof. And tonight, I have the pleasure of having Nadine Delipiani as a guest. Thank you so much for coming, Nadine.
Thank you for inviting us, Jerry.
And what I would like to know, and probably everybody would like to know, is once you know that you're pregnant, what is there in place? I mean, what does somebody have to do?
What we would recommend as a midwife from maternity, we would suggest your first primary contact is to go to the health centre, the primary care centre. At the reception desk, there are actually forms that we've prepared for all mums to fill in with basic contact information, name, address, the first day of your last period, and that will give us a basis to calculate how many weeks you are. And based on that, once we know you're between 8 to 9 weeks pregnant, we actually call you and we arrange the booking appointment. So what women can do beforehand, and this is very important, is actually make sure that their registration, their entitlement to the GHA health scheme is in place. And a lot of mums, they do with time sometimes forget, and their health card expires, it lapses, and this can actually delay the process of getting them into the hospital and starting screening. For us, early booking means early screening and the opportunity for mums to make a decision about the healthcare and how they would like their pregnancy to commence.
I agree. I agree that everything would go more smoothly if people would actually follow what is in place. And how important is it to actually have early screenings?
It is, because a lot of women have very different perceptions about how they want their pregnancy to continue, and screening would identify if there's anything that needs to be considered, if something different has to be looked at. And the sooner you realise you're pregnant, the sooner you pass that information along to the relevant health professional, which in this case would be the midwife, the sooner we can start the process off for you, and we can actually tailor your pregnancy to you. When I mention that, what I'm talking about is consultant care, because we have obstetricians in the hospital who'll be looking after you as well, and the midwives. And for those who need that extra bit of attention and care, we can start that from the word go.
Thank you, Nadine, for letting us know and letting you know what you have to do as soon as you know that you are pregnant. Thank you so much for coming in tonight. Now let me give you some facts when trying to conceive. Most women have a 15 to 25% chance of getting pregnant during their cycle. For the average couple, having sex once a day provides the best chance of getting pregnant. To optimize your chances of getting pregnant, after your partner ejaculates, remain on your back with your hips elevated for 20 to 30 minutes. The woman on top position isn't great for pregnancy, since the ejaculated sperm may flow out, and nearly 50% of couples conceive during the first 3 months. 75% of couples conceive during the first 6 months, and up to 90% of couples conceive during the first year. On average, there are 280 days from the first day of your last period to your due date. Here are some tips for foods to avoid when trying to get pregnant. You will need to prepare your body for pregnancy, and this will involve paying a lot of attention to what you eat, because what you eat goes directly or indirectly to your baby before and during pregnancy. Your baby's organs begin forming around 17 days after conception, when most people don't know they are pregnant. Most doctors recommend that you take a little control over the natural process of pregnancy and see a doctor before you conceive to make sure you and your baby get a healthy start. Prior to conceiving, women should have a checkup and consultation with their obstetricians to discuss general health and how it may affect a pregnancy. Doctors will also want to review any medical treatments, medications, vitamins and herbs you may be taking, as well as some may be harmful to a developing baby and should be changed or stopped before getting pregnant. You and your partner should give yourselves a few months to prepare for pregnancy with a little planning, some common sense, and by following the advice of your doctor, you will be able to start your new family in the happiest, healthiest way possible. Here is a list of foods that you should avoid. They could cause food poisoning or harm your unborn baby. Cheese. Okay, don't eat mold-ripened soft cheeses such as brie, camembert, and others with a similar rind. Soft blue-veined cheeses such as Danish blue, gorgonzola, and roquefort. Cheeses like this are made with mold and can contain listeria bacteria that cause listeriosis. Even a mild form of this infection in a pregnant woman can lead to miscarriage, stillbirth, or severe illness in a newborn baby. Eggs. Don't eat raw or undercooked eggs, and avoid foods that contain them, such as homemade mayonnaise. Make sure the eggs are thoroughly cooked until the whites and yolks are solid. This prevents the risk of salmonella and food poisoning. Pâté. Avoid all types of pâté, including vegetable pâtés, as they can contain listeria. Meat. Don't eat raw or undercooked meat. Cook all meat and poultry thoroughly so there's no trace of pink or blood. Take particular care with sausages and minced meat. Some countries advise pregnant women not to eat cold meats or smoked fish because of the risk that the food may contain listeria bacteria. Liver. Don't eat liver or liver products, such as liver pâté or liver sausage, as they may contain a lot of vitamin A. Too much vitamin A can harm your baby. Vitamin A Never take a high-dose multivitamin supplement or fish liver oil supplements. Any supplements containing vitamin A. Fish. There are some types of fish you should limit, such as tuna and oily fish, and some types of fish you should avoid completely, such as shark. Also, don't eat raw shellfish as it can cause food poisoning. Alcohol. Avoid drinking alcohol if you're pregnant or trying to get pregnant. Too much exposure to alcohol can seriously affect your baby's development. Caffeine. Limit caffeine during pregnancy. Don't have more than 200 milligrams of caffeine a day. High levels of caffeine can cause babies to have a low birth weight. Too much caffeine can also cause a miscarriage. Caffeine is found naturally in some foods like chocolate and is added to some soft drinks such as cola. Also avoid cigarettes and drugs as this harms both you and your baby. And to reduce the risk of toxoplasmosis, wash fruit, vegetables and salads to remove all traces of soil which may contain toxoplasma, a parasite that can cause toxoplasmosis. You should, however, take a vitamin supplement containing 0.4 milligrams of folic acid. This should be taken at least 3 months before you try to conceive. Folic acid in your diet lowers the chance of having a child with a neural tube defect such as spina bifida. If you're taking prescription drugs, ask your doctor about them before you become pregnant. Some blood pressure medications are not safe in pregnancy and should be avoided. Seizure medications may also be an issue, and it is best to discuss the pros and cons of continuing the medication before trying to get pregnant. Allergy medications fall in the debatable zone and can be considered harmful based on other factors. You must consult your doctor about these. Among over-the-counter medications for pain relief, Tylenol is safe, but ibuprofen isn't. Ibuprofen interferes with implantation and causes other problems in pregnancy. Birth control pills can also be harmful. When trying to conceive, you must consult your doctor about when and how you should stop taking birth control, and how long should you wait before getting pregnant. Most doctors advise that you should stop taking birth control pills 3 months before you actually try to get pregnant. In this period of time, you and your partner should use a barrier method of contraception, like condoms, diaphragm, cervical cap, until you start having normal cycles. The most important benefit of getting off any oral contraceptive is that you will soon begin to cycle on your own without medication. It also prevents any ill effects from the medication on the soon-to-come baby. If you get pregnant immediately after stopping the pill, you can chalk up a missing period to the effects of stopping the pill and may not realize that you, in fact, have been pregnant for a few months. Okay, here are some tips when choosing the sex of your baby through diet. The sex of a child is determined at the moment of fertilization when an egg containing an X chromosome encounters a sperm. That sperm can contain either a Y chromosome, in which case the embryo will be male, or an X, in which case it will be female. Research shows that consuming more calories and having a higher quantity and a wider range of nutrients, including potassium, calcium, and vitamins C, E, and B12, increases your chances of having a boy. In other words, women who want a son should eat a generous bowl of cereal for breakfast, munch bananas throughout the day, eat more red meat, use more salt, and boost their overall daily calories by 400 calories, the equivalent of a meal. Sorry, girls. For a girl, you should increase fish, vegetables, chocolates, and sweets. Eating more than 2,200 calories favors boys, compared with eating less than 1,850 calories for girls. And this could explain why more girls are being born as we reduce the amount of calories and fats in our diets. Now tonight, I'm also joined by two midwives from St. Bernard's, Natalie Lombard and Nancy Lopez. And Natalie, because we've spoken about the foods, I just want you to elaborate on how important it is or how dangerous it is for these tips, you know, to be taken seriously.
Well, it is obvious. I mean, studies have shown that maintaining a healthy diet and a healthy lifestyle in pregnancy will obviously increase your chances of having a healthier baby. And as we said, you know, we mentioned all these foods to avoid. And the importance of avoiding these foods is to prevent the risk of miscarriage and abnormalities that can occur to the developing fetus. I think one of the most important things for us as midwives is we see an increased amount of women coming to book with us who are not currently taking the recommended 400 micrograms of folic acid. And it is a very strong recommendation to take the folic acid at least for a few months before trying to conceive even. So as you mentioned, you know, to try to prevent the formation of neural tube defects.
Thank you, Natalie. And what about lifestyle? We've done a little bit on smoking, but this is really, really important, isn't it?
Well, smoking cessation is a big health issue here in Gibraltar because a lot of us tend to smoke. What we can do, I mean, as midwives, if you're trying to get pregnant, the biggest recommendation is that you stop smoking. There is a service, your GP, you can go to your GP and they will help you with your smoking cessation. They'll either refer you to other professionals that will help you or even prescribe some pharmaceuticals that will help with the addiction. It is known that smoking causes a lot of respiratory malformations in the fetus and the newborn baby, for example, asthma, bronchiolitis, and such. So the sooner you stop smoking, the better.
What about alcohol? Alcohol is an issue as well.
Alcohol is a big issue here in Gibraltar, especially with the teenagers. The same goes for alcohol. The sooner you stop taking alcohol, it reduces the risk of miscarriage and reduces the risk of malformations in the fetus. There is a distinct malformation that's called fetal alcohol syndrome, and we can see that if you take at very, very advanced levels of alcohol during the pregnancy. So again, the sooner you stop taking alcohol, the better your chances of having a healthy, normal baby.
And I wanted to ask you both, since we've said about, you know, having a girl or a boy, and since more calories are prone to you know, for you to have a boy, is this something that you're seeing in the hospital? Because obviously, you know, women are trying to diet all the time. We're trying to be slim. So we're trying to cut down on the calories. So is this real? I mean, is this something you're seeing?
I think really at the end of the day, the reality is that at the end of the year, when we do count the numbers of deliveries, we tend to find that it equals itself out. We do have normally the same amount of girls as we have boys. So, you know, whether it is actually a fact or not, you know, who knows? But undereating does come into our health promotion because we do find that a lot of women are very skeptical about putting weight on during pregnancy, and actually it's an opportunity to tell them that it is normal. I mean, it's normal to put on more than 12 kilos in a pregnancy. So, I mean, there's no reason to start dieting now.
No, especially when you're pregnant.
Exactly.
And you can enjoy your pregnancy and enjoy your food.
Yes.
Well, thank you. Thank you
Thank
so
you very
much for
for
joining
having us.
me tonight.
Thank you.
Let's get ready to talk about positions for successful conception to get pregnant. You'll need to conceive at the right time, and to get the gender that you want, you'll need to conceive in the right way. X and Y sperm behave like polar opposites. The boy sperm are fast and puny, and the girl sperm are slow but strong. This is important to remember as you are putting together your conception regimen. Sexual positions are an important part of this regimen because the positions that you use will either place the sperm closer or further away from the egg, giving the different sperm chromosomes an entirely different experience and a better chance of producing a male or female baby. Shallow penetration favors a girl. Egg sperm can live for days without being compromised, so it's advisable to conceive in the early part of your fertility window if you want a female baby. The egg sperm can afford to wait around, and shallow sexual positions work well for this by placing sperm further away from its final destination. Examples of applicable positions are the traditional missionary style, spooning, and female on top. Deep penetration is more likely to produce a boy. The Y sperm are very vulnerable to just about any bad thing that can happen to them. That's why it's advisable to conceive a boy on the day of ovulation, because these guys can't afford to wait. Using deep penetration will give them a quicker trip and will ensure that they don't have that far to travel. Examples of these include a variation of the missionary style, with the woman's legs greatly elevated to create an upward angle. This can be helped by placing a pillow underneath your hips, and it's important to keep your legs elevated for up to 20 minutes after ejaculation. I hope, ladies, you have time for this. All these tips are great, but the one thing that will ensure a healthy pregnancy is our fertility. So let's improve that with today's recipe, clams in black bean sauce. Let me give you some facts about clams. They're low in fat, high in protein, and rich in calcium for strong bones. They have particularly high iron content, and just 100 grams of shelled clams provide a whole day's intake of iron. Iron carries oxygen from the lungs to all parts of the body and is vital for our immune system, helping to increase resistance to infection and help the healing process. For women who suffer from anemia due to iron loss during menstruation, eating clams is a great way to replenish iron in the blood. They are high in selenium, the anti-cancer mineral, and a good source of zinc to boost the immune system and fertility. We've come to the section of our show with the exercises to prepare your body for pregnancy. Okay, so for pre-pregnancy fitness, it's important to be fit and healthy, no matter what your circumstances. However, if you've just become pregnant or are trying for a baby, it's essential to be in the best possible shape. If you're planning a pregnancy and want to find ways to improve your health and lift your energy levels, a pre-pregnancy fitness program is the best choice for you. The right exercises and nutrition can even boost your sex life, giving you a greater chance of conceiving. A good pre-pregnancy fitness program can also help you combat tiredness and fatigue, backaches and pains, varicose veins and bad skin, constipation, stomach aches, circulation problems, low stamina, and help increase your energy. A few quick tips on pre-pregnancy fitness. If you have never exercised before, think slow, gentle, and steady. It puts less strain on your body, and you should start with a 2 to 3 30-minute session per week, rather than jump on an intensive fitness regime with a high risk for injury, and the chances are that you will then not be able to exercise at all. Make sure you're properly warmed up and stretched before doing any pre-pregnancy fitness, and this minimizes the risk of strains and aches. And remember to cool down and stretch after you have finished. The cool down will help the body recover slowly and minimize the risk of feeling dizzy or unwell. Avoid overheating. Make sure you drink plenty of water. Don't push yourself too hard. Avoid exercising if it's too hot, and wear suitable clothes. An overheated body can damage the development of the fetus. Eat right. Get all the vitamins and minerals you need for you and your child, and monitor your condition. If you feel faint, you start getting cramps or aches, feel dizzy, nauseous, or you start getting any vaginal bleeding, stop your exercise program immediately. If the symptoms persist, consult your doctor. Pre-pregnancy fitness has to do with getting your core stable. And one of the key areas that you should exercise is the pelvic region. This area is put under a lot of stress during pregnancy and labor, and so by strengthening it now, you may make things easier later on. Try these simple exercises with me. We're going to lie back on the floor. Keep your knees raised and your back straight. Keep your arms by your side and gently contract your pelvic muscles. This is all you have to do. Okay, this is as if you're holding the flow of urination. You hold it for 5 seconds at a time, and you can repeat this 10 to 20 times. Don't strain too much though. Okay, you can even do these pelvic exercises when you're sitting watching the TV or out and about, for example. You try tensing your pelvic floor muscles as if you're trying to stop the flow of urination for a few seconds and then relax. You do this several times over. You can even try this in mid-flow when you're sitting on the toilet. To make it a little bit harder, you can elevate your pelvic floor. Make sure that you're holding as if you're trying to stop urination, and then release. And again, you should do this exercise for a repetition of 10 to 20 times. Well, we have come to the end of this week's show. Please join me next week when we will be taking you through all the stages of your pregnancy, showing you the perfect way to exercise and giving you a delicious new recipe for you and your growing baby. Thank you for watching, and good night.